so I should take the class. We'll do short, fast. Most of you had the request for lab reports. Yeah, we do that. How do you explain the lab report to the client? Just because February exam is finished, though it was for the previous batch, so students are less attending. They forgot actually that they had not appeared the exam, and that exam was for the previous batch. They just thought, okay, exam over, so next class bunk. Those are ultra legend, you know. We will do this lab report random. We'll enjoy that fun today. Okay. So life is not systematic. The diseases, they don't come systematic. So we will see as it comes. There is every page, a new client. A new client is coming to you and telling you that they have this lab report. What is the meaning of this? So if you're a doctor, you will just take the report. You will not talk a single word and you will write a medicine. Your work is done. You can still earn money because you're a doctor. But if you're a nutritionist and dietitian, you have to explain to the client, what is this? What is the meaning of this test? What is the meaning of interpretation of your result? When we check it, yeah. If it is abnormal, what is the meaning? If it is normal, what is the meaning? If it is abnormal, why you need to come to me to take your consultations? Glycosylated hemoglobin, HbA1C. So it measures diabetes over a long period of time. So you want to check diabetes control. Normally, when you do only glucose, one prick. So you are measuring for that particular day, particular instance actually, particular moment. But if you want to check over the period of time, how has been your control? Are you taking medicines? Are you following lifestyle changes? Are you eating healthy? Then this test will tell you. So RBCs, they have a lifespan of 3 months. During this lifespan, they are storing a molecule called HbA1C. And we measure this molecule. If your throughout these 3 months, your blood glucose is high, so it will also show high. So there is no cheating here. Just before the test, you do not eat sugar for 2 days, thinking your blood glucose, most of the patients do that, thinking your blood glucose will be less, but HbA1C will tell you. One part. Second part, if your HbA1C is higher, even if you are not diabetic, there is a risk that you are on the path of becoming diabetic. So you will have some symptoms. Okay. So the number one symptom you will have will be sugar cravings, more urination, drinking more water, right? And the performance issue. So these are the early symptoms. Now you don't need to remember all these things, comments, factors that affect and all those things. Forget those, not required. Okay. Now what is the meaning of HbA1C is high? So am I going to die? Are you going to die? Answer is yes. Answer is yes, Darshana. So there is a calculator which you have learned. In that calculator, diabetes is one of the predictor, stronger predictor. So it adds 4%, 5% chances of death because of myocardial infarction or stroke. So if you have diabetes, 4 to 5% chance of you dying in next 5 years has increased. Right? Few years of your life are gone already. Understand? We are taken in the chapter of diabetes. Even if you control diabetes, that problem is still there. So the question in that calculator is not whether the diabetes is under control, not control. Question is whether you have diabetes. So if you have diabetes, you have inherent tendency to die early. So now you are not yet diabetic, sir. This is a pre-diabetic level. You see normal and at risk for diabetes, 5.8. So 5.7 to 6.4. So there is still a hope. You can still survive normal. Yeah. Provided you don't do any fights with your wife and she kills you one day, or you land up in some road traffic accident. So as long as that problem is not there, if you survive your wife, you will probably survive this diabetes. Don't be so serious when managing the client. What is the best quality? Number one best single quality a consultant must have. Either you are a nutrition consultant, dietetic consultant, doctor consultant, or a psychology consultant. What is the number one quality you need? Write down in the chat. Whatever you feel. You can write 2, 3, 4, 5, but I prefer only one. If you have that one single, everything is done. Even if you don't have others, it's okay. Very good. Smile. This is another client has come to us for with the blood report of blood count. Yeah, CBC. Everything is there. So it has. So you have to tell the client what is the component of this, because you are not a doctor that you can tell them that okay, everything is normal. They are not satisfied. They are paying you money, and you are a nutritionist. So your role is to engage them in a conversation, tell them, explain them, so that next time they come to you and they refer other clients, and next time they do any blood report, they come to you just to understand. They pay you money just to understand the blood report. They are curious. They don't want one line answer. Yeah, report is normal. Yeah, but I'm still worried. Why did you do the report then? Yeah, if report was supposed to be normal. So complete blood, it has hematology means blood test. So means the cells of blood. So there are three types of cells: RBC, WBC, platelet. So we are measuring everything here. Three RBCs, this DLC and ALC is WBC, and last is platelet. We are measuring. In the RBCs, we are measuring different parameters. And common parameter which you know is hemoglobin. If it is low, then anemia; high, there is no problem, right? And the other parameters, if like these are elevated, if these are lower, these parameters, okay, it means uh, either there is iron deficiency or you have vitamin B6 and B12 deficiency, or and it can be both. Sometimes you may have good iron, okay, because you are eating something, but you may have B6 B12 deficiency. Why not B6 B12? Because it is required to manufacture hemoglobin. It is required for healthy RBCs. Now there is something this reference value. Okay, it may be little different for every lab report. So you don't need to remember. People ask me this question: should I remember this lab values? No, it's a useless data. It is going to be there. You should never remember this. Now, differential leukocyte count. It means that out of 100 cells, 100% cells, what is the component of neutrophil, lymphocytes, monocyte? What is the percentage? Okay. Now we have to just worry if neutrophil is high, lymphocyte is high, it means infection. Okay. If it is low, then it means something else. It's good, you don't have that problem. Eosinophils for allergy. Similarly, it is very rare that you will have monocytes and basophils high. Okay, you need to worry about neutrophil, lymphocyte, basophils. Anyways, you have eosinophils, and anyways, everything is normal for you, so you don't need to worry. If you have to explain them what is the meaning if it is high, what is the meaning if it is low. Right? So they are like, yeah, next time I understand very well. Yeah, so they will remember you for lifetime for giving you them this knowledge. No one has explained them. So objective, they have been visiting many consultants. Okay, they have been meeting many people. So objective is for you to get them registered in their mind. Okay, they should remember your name. Absolute leukocyte count. So this here we were checking differential leukocyte count, we were checking the percentage. And here absolute leukocyte count, we are checking actual what is the count. Yeah? There is a machine which measures that. So here if it is low, then WBC production is less, not good. If it is high, then there is infection. Simple. Yeah. Don't say if it is high, it can be cancer also. Otherwise, next time they have high, they will go into panic attack. You can do that if you are like that doctor, there are some doctors who, if you cannot afford the milk for the protein powder, drink the protein powder in the water. Unless you are doing some test for that, don't do that. Platelet count. So platelet count typically is the range 150 to 410. If it is less than 1 lakh, then we say that something is wrong. If it is below 50,000, we have to admit the patient. If it is less than 25,000, the patient will have bleeding. If it is less than 10,000, critical scenario, life and death fight. Yeah, time to write your will. And if you watch Hindi serial, before the husband dies, the wife is already searching for the next husband. Time for that has come. But in your case, your wife will have to bear you few more years because everything is normal, sir. Erythrocyte sedimentation cover. So this is the generalized test. Many times most of the people, they have this test high because they do the blood report not as a routine, but when they have some condition, either autoimmune or either infection or something. Most of the time it will get elevated. It has no meaning. Okay. Like there are some doctors who say your ESR is high and patient is like, oh my God, my ESR is high. Yeah, but it has no meaning actually. On the basis of ESR, you are not going to do anything. ESR is high, it means that there is some inflammation going on. That inflammation can be as simple as the fever. It is not the cancer, it is not the autoimmune disease. Don't worry. It represents general overall inflammation in your body. Right? With medicines, it will get covered. Don't forget. It is the least significant test, according to me. Urine. Now, typically, when will you do urine? In two scenarios, when you have a renal case or you have a diabetes. Okay. Now, in renal case, it can be nephrotic syndrome or it can be renal failure. If it is a nephrotic syndrome, the patient will lose protein. Right. So protein will be appearing here in this microalbumin. Right. And if it is a diabetes, then sugar will appear. If it is completely uncontrolled diabetes, like a hopeless and gone case, time to write the will, then protein will also appear here. So what is this? There is a kidney. There are two kidneys. In the kidney, there are nephrons. Each individual cell is called nephron. They have some little pores. Because of these pores, the water molecules will go and excreted. Along with that, some harmful chemicals like urea and all those things will get excreted. Creatinine, all those harmful things will get excreted. But the kidney, the nephrons, these cells have minute filter only, minute holes. It allows only small particles, not the big particles like the protein. So if the protein is present in the urine, it means the kidney is damaged. These nephrons are damaged. The hole is become bigger. Yeah, it is a microscopic. Don't worry. You will not be able to see that. No, you don't need to change a kidney at this time. So in diabetes, what will happen is normally the glucose molecule also goes in the urine, but it gets reabsorbed or it goes only less. But if the glucose in the blood is so high, so more glucose will go leak to the urine, to the kidney. And now this is a time you need to take precautions. Okay. So microalbumin means protein, albumin, in the egg, the yellow, albumin, a white part. Yeah. And creatinine is one of the excretory products, right? So it is secreted in urine. If it is high, then we need to see for something. Sometimes uric acid is also high. Then it means that there is a problem in the metabolism. So typically that will be high when the patient will have complaints of joint pains and all those things. Okay. Whatever is not there, don't tell the client. Okay. So, but you should tell the client if it is low, what is the meaning? If it is high, what is the meaning? Why this molecule we are measuring? Okay. The kidney, the nephrons, everything. They like this knowledge. Yeah? They are lay people. Okay. And they like you because you are explaining them this knowledge. C reactive protein. Again, this is a generalized inflammatory marker. just to say you that there is an inflammation going on in the body. It can be autoimmune disease or it can be an infection. That doesn't represent that you have the cancer or something. So C-reactive protein, many times patients, they come and see for cancer and they think something else and they start worrying so much. And some doctor, they tell your C-reactive protein is very high. Yeah, but it has no meaning actually, right? Why do you need to worry about that? It is unless you have ICU and you want to admit the patient. You want to listen to the story? Yeah, some malpractice by some stupid intern. Yeah, you know who's that person. You want to listen to that story? I was working in private. No, this story is not a good story. I should not be telling it on YouTube. Yeah. So I will think on something, modify it, and then speak. So this is not my story. I'm not that intern. Yeah. So, but I will tell you one doctor's hypothetical story. Yeah. Okay. So, a private hospital. Yeah. So the target is the bed occupation. Yeah. And the target is maximum ICU occupation. When the ICU beds are like 5 beds at a small hospital, 5 beds are there, and 3 beds are occupied, 2 beds are vacant. So one bed you have to occupy whatever next patient comes. That is a target. And then, so the next patient comes is the just out of the OPD time, 9:30 p.m. 9:30 p.m. No one comes for BP check, right? Right. So you have, if 9:30 p.m. you are coming for BP check, it means you have the heart attack. There is no other diagnosis, or you are going through arrhythmia. Yeah, your palpitation is more and your heart rate is very high, and there's all the stupid things are there, right? So that is assumption for an internet test. So 9:30 p.m. the patient comes for BP check, and oh my God, you are going into heart attack. The BP is little high, but not much high actually, 130 by 84. So, but you know your heart rate is very high, and you need ICU admission. You may go heart attack. So, but sir, everything is normal. No, you came at this time, 9:30 p.m. The only reason you come 9:30 p.m. is you have the heart attack. And I have 2 more ICU beds to fill tonight. What that mean? Admit in the ICU. Then the senior doctor comes and says, you admitted a normal patient in ICU. Yes, sir. You are a legend. Legend. Very good, very good. So others, they typically wait for the some patient, ICU patient, to get admitted in ICU. So you are admitting the normal patient not in the ward, but in the ICU. Very good, very good. I like you, Intel. I love you so much. You are going to be my next वारस को क्या बोलते हैं इंग्लिश में? You will own this hospital. Are you that intern or are you that practitioner? Yeah. Calcium. No, Darshan is saying no. Your daughter is saying yes, yes. Calcium. So calcium you check. This is very important. Okay. So if your calcium is low and high, don't think you are deficient in calcium. Okay. Write down the differential diagnosis. If your calcium is high or more, which organ is a problem? Write down multiple options. Write down in the chat. Not in the book. Write down the chat, please. Any answer. Even if you give wrong answer, it's okay. At least you tried. You are not that hopeless. If you don't write, you know what is your diagnosis. Yeah. So having low calcium doesn't mean you are calcium deficient. Okay, understand this concept. And if your calcium is high, it doesn't mean that you're eating more calcium. No, that's not the problem. When you take the tablets of calcium, the whole is not absorbed. Yeah, only some part is absorbed, and the maximum part is which is not absorbed is causing you constipation. So it means that is not the problem for your hypercalcium. Okay. So there is a gland, parathyroid gland, which controls your calcium metabolism. So if your calcium is high, you must check your parathyroid glands immediately, and you may have renal calculi, right? So there is another way. So if you have a client who has frequent renal calculi, yeah, frequent operations or just frequent renal calculi, many of the calculi, they pass in urine with painful micturition, right? But they pass out and the client doesn't need surgery because the client is drinking sufficient water or maybe beer also. And but in this case, you should check parathyroid hormone, because if the parathyroid hormone is high, it will erode most of the bones will become weak and calcium level will be high. Okay. Another differential diagnosis for calcium, high calcium, is maybe some bone disease, systematic bone disease is going on. It can be very serious, it can be minor also. So if you have a high calcium, doesn't mean that you are taking excess calcium. You are having overdose of sunlight. No, no, there is something serious actually. Okay. Now, when we are talking of the sunlight, so along with the calcium, we want to check vitamin D. Okay. So if you have vitamin D less, obviously everyone thinks that the bones will be weak, the calcium metabolism affected, everything, hair and all nails. But the problem is with the intestine. So your absorption will get affected. You will have frequent diarrhea, you may have constipation, you may have nutritional deficiencies. Your villi will go weak if you are deficient in vitamin D. Most of your nutrition dietetic patient, even if they come from a good family, even whatever they eat, vegetarian, non-vegetarian, early wakers, non-wakers, non-wakers, yeah, there is no late waker, non-waker. They don't rise up at all. They are zombies. So if most of your clients, you will find vitamin D deficient. What is the solution for that? Very simple solution. Vitamin D oral solution. Arachnidol Nano is my favorite brand by Abbott. You take once a week. You don't need injections. Okay. Don't fall for that. Just one, it is a 5 ml bottle, 1 ml, sorry, 5 ml, one dose once a week. Continue for 3-4 months. Then once a month. Good. Arachnidol Nano. So your absorption will become better, your skin will become better, hair, the nails, the bones will become better. Now, when we are talking of bones, so one part is calcium, another part is vitamin D. There is third part also. That part is exercise. If you are sufficient in calcium, vitamin D, but you are not exercising, bones will grow weaker. After 40, the density of bones suddenly drops, especially for women. Okay, you have to be very careful. So is there anything else you can add in the food? Because you are so lazy, you don't want to exercise. So answer is yes. You can add soya bean seeds or flour of soybean seeds mixed with your routine flour. Because it has phytoestrogens. Yeah, these estrogens help you strengthen your bone. Plus, it is a high source of calcium. Good idea? Yeah, you are going to do. From the last class, how many of you have started soya bean seeds flour? Write down the chat if you are doing it. No. And all those remaining people who are not started, write down in the chat whether you are the early waker, late waker, or non-waker. When you sleep in the night, you dream that you should not wake up in the morning. You're so traumatized in your marriage that you don't want to wake up in the morning. Are you that person? Write down in the chat. It's okay. All of us have sympathy for you. Glucose fasting, one single incidence. That's it. It doesn't give anything. And you can cheat this. You can have less food the previous day. It will still be. But if it is frank diabetes, then if it is a like full-fledged diabetes, then you may not be able to cheat this. But still, there is a loophole. Yeah. Iron studies. What is the use of the iron studies? Only if you have anemia, now you want to know whether there are few causes. What is one of the cause? You are bleeding. Either there is your menstruation is more, or you are bleeding through your intestine, black stools are there, or piles is there, or you are bleeding through somewhere else. Okay. Option 2 can be worms. Most common reason, especially in children and mothers. So when you think children, so you forget the mother. That's a huge market. Do not forget. See, if there is a woman, she is obese, she has diabetes, she has something, she has gone to her doctor, she is already taking the medicine, doctor has already told her to have some healthy food, something, yeah? She is satisfied. And she is already married. She's not going to take any effort. So the nutrition and dietetic business, what is that business? You understand, there are only two markets for that business. One, just before marriage. 1 and 2 years before marriage. You want to look fit, you want to look young and all those things. Yeah. You want to look thin. And the other market is children and adolescents. Mothers, they don't worry if they are dying. Parents, they don't worry if they have diabetes, hypertension, or any disease. But if the child is lacking in the height, growing in the weight, lacking in the weight, growing in the height, if the child has white patches, gray hair, brittle nails, child has bleeding gums, child has something, or just the routine, I want healthy nutrition for my child. Yeah, people will come to you only. So that's a bigger market. So get certified for pediatric nutrition and early intervention child development. Yeah. So EICDL, there is a concept EICDL, early intervention child development. The problem is that if you miss some nutrition for the child at particular age, there is a long-term side effect. Long-term problem is there in terms of brain growth as well. Okay. We are not just talking of the height stunted. We are talking of brain growth. How much the child will earn. Yeah. So if you pay me some money now, your child will earn more. You like this idea? So early intervention, child development with the nutrition. So, or you can take up maternal child nutrition. In both these programs, there is a fees is very high, but I have the scholarship. Yeah, approximate 1 lakh scholarship you will get for this presently. Yeah? Talk to me if you are interested. You will get certified as pediatric nutritionist and EICDN consultant. So that title is very good. You will get certified as maternal child nutrition and dietetic consultant. Awesome title. That's a major market, you know. Okay. All those young people who are just before marriage, they are going to the gyms. They are not technically coming to nutrition, and the 12th pass person in the gym tells them what to do. Yeah, that is a market, right? So for you, the real market is going to be mothers, pregnant mothers, lactating mothers, and children and adolescents. Understand? And PCOD. So we are coming back to the topic, iron. For iron, if you are looking to get certified for PCOD specialized, okay, PCOD nutrition specialist, you can talk to me also. You will get resources for that. In present syllabus also it is there. Now for the anemia, either you are bleeding, either there are worms, either you are deficient in iron. In the good society, it is less likely, but it can be there. In the good socio-economic status, what is the more likely is the fourth one. The fourth one is vitamin B6, B12 deficiency. Simple, right? Plus the second option, worms. More common. The first option, higher bleeding, right? If it is a higher bleeding, obviously they need to visit the gynecologist to manage that part, or some women have tendency for that. So you will need to take care of your health in terms of nutrition. Iron, vitamin B6, B12, all three. You cannot just have. Plus, you need to add two more things. Vitamin C, so that iron is absorbed better. Zinc, because it is important in that metabolism, in that cycle. So what will you add if someone is deficient in, if someone has anemia? What supplements you will add? Don't add calcium, iron, and all this mixture and churn supplement. Yeah. So most of the supplements in the market, they have the component which antagonize each other. They act against each other. So don't add the churn. Yeah. Select what do you want. So select a product, a brand name which has this 4 or 5 things. That's it. I don't want everything. Yeah. Other than that, if you need multivitamin, you can take one multivitamin separately, separate different time. Okay. So what will you add? Write on the chat. What will you add? This is an important question. So you have to explain to the client this thing that iron deficiency does not mean you are deficient in iron. You need to add more things. Yeah, vitamin C helps in absorption of iron. You need to add zinc so that it gets metabolized. Then you need to add vitamin B6, B12 so that hemoglobin is formed. Like it? Everyone's favorite, cholesterol. If someone has high cholesterol, what to do? Step one, calculate how much likelihood you will die in next 5 years. But it doesn't add so much. Diabetes adds so much. Smoking adds so much. Hypertension adds little bit. The cholesterol, it adds little bit. Okay. And now there is a controversy going on in the cholesterol market. All those figures which these big bodies they have given, they were manipulated by pharma companies. So there was a time when a particular figure, like take example 150, yeah, this was considered normal. Then pharma companies influence these bodies and say, no, no, not 150, 120 is normal. So suddenly, all the 50% of the world population, they became abnormal. You understand? Okay. So this controversy is going on. And if you see in the calculator, if you change the cholesterol level, it adds only little bit percentage of your likelihood of dying. So don't worry so much. You have the hope because you have come to me. Don't pay a lot of money for the bigger doctors and don't pay a lot of money for the medicines. You come to me, I will tell you what lifestyle changes you can do, what food you can do. And I will not, you have to tell them that I am a nutritionist and dietitian who will not change your thali. I will understand what is your thali and then will modify it and will change certain things as per your taste, your liking. I will not tell you that stop eating everything. You will do that for 1 week. After that, you will eat all the pizzas in the world. You want to listen to the pizza story? So there is a story for pizza. So we'll stop this share. Yeah? Come to the story. Very good. So there are two types of people in the world. So one who like Domino's pizza and one who like Pizza Hut. Right. So if you're a Domino's person, if you eat Pizza Hut, you will have anxiety next day. Yeah. And if you are a Pizza Hut person, Domino's you will not like. Yeah. You may have some problems next day. Irrespective of that, I'm a Domino's person. So there was once upon a time, for whole 1 year, I ate Domino's daily, 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 daily. And the day I didn't order Domino's, so I used to get the call. Sir, is everything all right? You didn't order Domino's today? Yeah. And I used to get a lot of coupons, free coupons and all those. And obviously the late delivery is always free. Yeah. And I was like the most valuable customer for that particular Domino's store. Um, After approximately 1 year, I went to, I used to visit the temple, but on that particular day, I ate food at the temple. And after almost 1 year, I ate roti because I didn't eat roti. I was so poor that I was eating Domino's every day. So I ate roti after 1 year. And the day I ate roti, this is the taste of the roti. So nice, so good. I've been missing this and I was eating Domino's. During the same time, approximately same time, there was the news all over TV. There was earthquake in the China, and the whole village got killed and destroyed and everything. Yeah, and after 14 days of rescue, they found out a pig from the debris, and the pig was alive, obviously malnourished and everything, and then they fed him something, and the pig had tears in his eyes because he had the food after 14 days. How was that pig? I was crying that I'm eating roti after 1 year. So nice. The roti is so good. And I remember that pig. So then I stopped Domino's. Okay. Then after after almost 10 years after this, eating 1 year Domino's, I had repeated chest pain. Thankfully, it was muscular, but I'm very health conscious person. I eat only Domino's. I don't eat Pizza Hut. And when I eat Domino's, I tell them that, hey, don't put cheese in my pizza. I'm so health conscious. So I went to cardiologist and they said like everything is normal, ECG normal and everything is normal. And this is probably muscular chest pain. I said, no, there must be something else. I want you to find out what is that.